As surgery becomes more complex and more potentially difficult to do, we all recognize as surgeons that a key piece is how do we train people to eventually learn these skills and do them safely. And so it's very important to be able to as closely approximate what one might expect to find in a surgical environment, but where the stakes are not as high. Virtual reality techniques to essentially try and reproduce in a 3D environment what an operating room would look like for a surgeon or for somebody who's training to be a surgeon. So the hope is and the goal is that you can essentially duplicate on a procedure by procedure basis many of the things that we do as surgeons. And so when I first put that headset on, I mean, it's very cool, right? I mean, it's really quite remarkable how vivid and how real that image is, and essentially the ability to effectively walk in an operating room. We want to optimize the experience both for our patients as well as our trainees. We want to be able to train people as best as we can, and we want to be able to create an environment that's as safe as possible for our surgeons. So what appeals to me is the potential for this technology to be able to approximate in a very close way what I've been used to doing in the operating room for the last 20 years. That's what excites me, and I think there's a real potential to grow from that.